The amiss of Obamacare, the 7 downfalls of the healthcare reform. The amiss of Obamacare, the 7 downfalls of the healthcare reform. At a time of rising unemployment, the government would raise the cost of hiring workers by requiring employers to provide health insurance to their employees or pay a fee or tax to subsidize government coverage. Every American would be required to buy an insurance policy that meets certain government requirements. Each individual who currently are insured and happy with their insurance will have to switch to a plan that meets the government's definition of acceptable insurance. If you think healthcare is expensive now, wait until you see what it costs when it's free. A government-run plan similar to Medicare would be set up in competition with private insurance, with people able to choose either private insurance or the taxpayer-subsidized public plan. Subsidies and cost shifting would encourage Americans to shift to the government plan. Eventually, though, those guidelines likely would become mandates, extending to private insurance plans, resulting more rationing of the nation's medical care, a requirement to insure all applicants, and a prohibition on pricing premiums on the basis of risk. Finally, the government would subsidize and manage the development of a national system of electronic medical records. Taken collectively, they dramatically would transform the American healthcare system in a way that would harm taxpayers, healthcare providers, and most importantly, the quality and range of care given to patients. Private insurance will still exist, at least for a time, but it would be reduced to little more than a public utility, operating much like, for example, the electric company, with the government regulating and controlling every aspect of its operation. The net result would be an unprecedented level of government control over 1/6 of the United States economy and some of the most important personal and private decisions that Americans would make. Insuring the insured. The direct cost of insurance that would be imposed on employers, businesses also would incur significant administrative costs. Low-skilled and wage workers particularly would be at risk. Roughly 43% of uninsured employees are working within $3 of the minimum wage. The most likely outcome would be greater unemployment for workers who lack of skills does not justify the increased cost. Over 1 million jobs could be lost in the first 5 years after an employer mandate was imposed, of which 2/3 would be from small businesses with fewer than 500 employees. As in this case, with an employer mandate, an individual mandate simply is a disguised tax. Americans are insured or not, whether they are, could be penalized for those who have not complied with the mandate. Many of those who fail to comply with the mandate indeed will be low-income Americans. Of those without health insurance today, nearly 1/4 have household incomes of less than $25,000 per year. These individuals will almost certainly lack the resources to pay any penalty, particularly a lump sum penalty, assessed at year's end. Even more significant issue is it could lead to greater government control of the healthcare system. An individual mandate would be an unprecedented expansion of government power and intrusion into the lives of every American. Regardless of how it was structured or administered, such a government-run plan could ultimately or would be subsidized by American taxpayers. A government program also would have an advantage since its enormous market presence would allow it to impose much lower reimbursement rates on doctors and hospitals. The result would be a death spiral for private insurance. From private to public. For companies to dump workers into the public plan, that means tens of millions of workers who would rather stay with their current job-based plan no longer would have that as a choice. They effectively would be forced into the government plan. Benefits, reimbursement rates, and subsidies that were structured, people would have to shift from private to public coverage. Different ideas of what quality and value mean to them based on such things as personal pain tolerance, lifestyle, feelings about hospitalization, desire to return to work, and so forth.
Feelings about hospitalization,
Who is better suited to determine which of these procedures represents quality and value? A government board or the person directly affected? Second, comparative research too often has a tendency to gear its results to wage the average patient. Prohibiting reimbursements from some types of treatment, the impact on patient outliers could be severe. Whether quality or value includes consideration of the relative cost of a treatment.
Whether quality or value includes consideration of the relative cost of a treatment.
Catering to the healthy. Almost any healthcare reform plan is going to contain a certain amount of subsidy to help low-income individuals obtain coverage. After all, the number one reason people give for not purchasing insurance is that they simply cannot afford it. However, if such subsidies go too far up the income ladder, they easily can create more problems than they can solve. As with all means-tested government programs, we can expect the new middle-class welfare benefit to discourage work, family formation, wealth accumulation, and self-sufficiency, while creating a voting that favors ever-expanding benefits. No one knows how much the final health care plan reform will cost. However, estimates for government programs have been wildly optimistic over the years, especially for health care programs. Reform supporters now must look for other funding mechanisms. For instance, open the energy taxes as a way to pay for health care reform. However, such measures will fall short of what is necessary to pay for the full cost of the reform plan. It will be necessary, therefore, either to run up more national debt at a time when massive future budget deficits threaten to bankrupt the community, or for the President Obama to break his pledge not to raise taxes on the middle class. Again, I say to you, if you think health care is expensive now, wait until you see what it costs when it's free.
If you think health care is expensive now, wait until you see what it costs when it's free.